You were appointed by Speaker Joe Strauss to serve on the House Committee, Mental Health Committee. Our state mental health hospital has 300 beds, only 80 of which now are for forensic criminal, or all but 80 of them are for forensic criminal beds. Bexar County serves 1.7 million people plus 55 surrounding counties. Contact beds are not long-term beds, so what's the solution to increase the capacity to serve the mentally ill here in Bexar County and surrounding areas?
Well, first I want to say, it's an honor to be on this Mental Health Special Select Committee. The only one from our delegation, Bexar County delegation, to be on it. There's a lot of work that we've done on it, a lot of hours of testimony, a lot of talking. Hearing testimony from the state, from like Clarity, Haven for Hope, so there's a lot that's going on, and we've taken tours. We set up a tour back in June to have chairman. Our chairman is Chairman Price. He's the chairman of the committee, and me, and a lot of the staff. We took a tour of all these places I had mentioned, and so we see what Bexar County is doing. Bexar County is actually the example of mental health of what, not only in Texas but across the U.S. We have different folks who are involved in mental health from like Chicago, Baltimore, Miami, Los Angeles, who come down to San Antonio because they see great things that the sheriff is doing with the diversions and what Bexar County is doing as well. With that said, it's still not perfect. The big issue is, like you said, is the beds, number of beds. We've taken a tour of the state facility here in town in San Antonio. So there's a lot of needs they have, whether it be from wages to personnel to beds, and the structure. These structures are very old. They weren't just weren't built the last few years, and so funding is a big issue that we hear about across Texas. Beds also as well, and also the rural areas. The rural areas suffer a lot. They don't get a lot of the attention that the urban areas get, and so most of my district is in the rural. I'd say about 70% of it is, and so that's something that we are looking at. We're hearing a lot of testimony, and we hear it, and I'm all for making sure that mental health has the funding it needs. But again, it depends on the budget, the way it looks, and the way I explain to my constituents, it's like a big pie. And everybody wants a piece of that pie. Transportation wants it, education, mental health, state employees. Everyone is important, and so we need to be focused on how we're going to do that. And the one part of it that I've focused on mental health is our kiddos that are in school. There was a lot of stats people threw around of how many kids now have more mental health cases now, and that's disturbing. Because a lot, some of it might be because of what's going on at home, what's going on at school, social media is a big part of it. So that kind of tells into cyberbullying a little bit, because there's a lot of mental health issues with that. But we're tackling it, and we have a couple more committee meetings, I believe, until we're done. And so we have a lot of great ideas for bills for next session.
I think one of the things we need to do is encourage mental health professionals to come here to Bexar County, because there's a really big shortage of good quality mental health professionals.
I agree.
So I hope we can do something to encourage them. I want to thank you for joining me today. It's been really educational. I think your constituents are really going to appreciate hearing from you. If anybody has any questions, you can get more information on Representative Galindo's Facebook or website at rickgalindo.com. Stay tuned for the next Bexar Moment coming up. It will be soon. Representative Galindo, thank you so much for joining me today. I really appreciate it.
Thank you.